Mr. Lockman, how's it going today?
Good.
That's good. My name is Brian Garvin. I'm your student physical therapist assistant. I'm going to be working with you, okay? So today we're just going to be working on some massage techniques, some manual therapy techniques, and just some strengthening exercises, just to kind of hopefully help decrease your pain and decrease your swelling in the leg there. So just before we start, this is going to require me to come in contact with your skin just to perform some of these techniques and exercises. So do I have?
Yeah.
All right, perfect. And then real quick, just going over some reasons why we would want to stop or just be cautious. You don't have any past medical history of any cancer in the area or anything?
No.
Okay. And just looking at the site, I don't see any large open wounds or any burns or anything like that, so that's good. Also going to be cautious just because of the hair in the area. Try to be careful just because that can be a little discomforting, as well as are you ticklish at all?
No.
Okay, perfect. And then just with stretching, you just want to be careful that there's no severe pain occurring with the stretches. And then also, you have some pain meds. So just that can mask some of the pain. So we'll just be careful of that as well. Okay? So we can go ahead and get started. So this first technique we're going to be doing, this is called effleurage. All right, so the goal of this, you have some swelling in your leg here. Okay? So
Okay.
this lotion. So basically, what we're trying to do is we're just trying to push this swelling out of the area, okay? So this swelling kind of starts to pool up down here in the lower extremity, and we just want to make sure that we're getting all that excessive fluid and swelling up through these. You have ducts in your legs that we can push that get it to circulate back through your body, removing the swelling from the area. So we would just do this for about 5 minutes before moving on to the next technique, okay?
I was just like, huh, it's like there was a fire alarm in the second one.
All right. Let's go ahead and rub down some of this on your lower leg. Actually, real quick too, I'm just gonna grab another pillow here. Just want to get that way your leg's not, there's no dead space under there. Just wanted to get some. All right, so just kind of feeling around your quad. I can feel that you have some adhesions here in the quad, and I know that you've been experiencing some muscle spasms. All right, so what we're gonna do here, we're just gonna do some thumb pad kneading, okay?
Okay.
So this is another manual technique. This is gonna help break up adhesions in the area, and it's also gonna promote blood flow and circulation to the area, bringing more nutrients. So that's gonna help with healing, hopefully to cut down on that. And then with the pain spasm cycle, basically we just want to prevent ischemic buildup of tissue. So again, just bringing circulation to the area, to the muscles.
Okay.
It's just going to help with healing, right? Feeling okay?
Yep.
All right. Any questions so far?
No.
All right. All right. So again, we would do this for about 5 minutes before moving on to the next technique. All right. So then we're going to kind of dry you off here for this next one. We want to make sure that there's no lotion. So this is a cross friction technique. So this is really for your scar. All right. So you're 3 months out, so you're still pretty far out for the scar to heal. But this technique is we're just running in one direction. All right. This is just gonna make sure that the collagen lays down correctly in that scar, just so that scar heals properly. Okay. So we want to make sure that there's no excessive buildup of that collagen in there. Okay. So we're just gonna be running across just in one direction. So applying my pressure one direction and just kind of coming back.
Okay.
Okay. So again, this could also help break up any adhesions within the scar as well. So same thing, we do this for about 5 times, or I'm sorry, 5 minutes.
Okay.
Wow, I just waited that whole time for this? Close your eyes.
Okay. All right. So just a couple more things. We're almost done for today. Let's get this wiped off. All right. So I'm gonna take these pillows out here. All right. So next thing we're gonna do here, we're just gonna get a little manual hamstring stretch. All right. So just after the surgery, it's pretty normal to, let me know when you feel
That's
a good
perfect.
stretch. Good there?
Yeah.
So after the surgery, it's pretty normal for your muscles to stiffen up, and you just pretty much you're going to lose range of motion. So you're lacking range of motion with knee extension
Mhm.
and knee flexion. All right. So this stretch is going to help elongate your hamstring muscles, which run on the posterior side of your leg, which is where you need your extension, which is important for walking. And just obviously normal daily activities. So we just want to kind of elongate these muscles, get some more length through there.
Okay.
Just so we got to do this over a period of about 4 to 6 weeks, so we can get so we can permanently lengthen those tissues. Right. So we would do this typically for about 3 times 30 seconds. Right, so we got about another 10 seconds. All right. That was okay?
Yep.
All right. So moving on to our next, or our last exercise here. Go ahead and lift your legs up for me. You can put both on here too as well. We want this under your knees. Right? Okay. So we're gonna throw this little ankle weight on. So what we're gonna do here, this is just a short arc, called a short arc quad. All right, so it's a strengthening exercise. It's gonna help kind of reinforce that stretch we just did.
Okay.
So we want to get length through the hamstring muscle, and then we want to strengthen the quad, so we can kind of utilize that new length of those tissues of the hamstring. Okay. So just kind of a light cuff weight just to start. All right. So I want you just to go ahead and kick this leg up for me, and I want you to squeeze. I want you to fire that as much as you can, and then back down nice and slow. Good. So we would do 3 sets, 10 reps. Pretty
Okay.
standard for strengthening exercises. And with this, you know, you could potentially be, tomorrow with strengthening exercises, you could be potentially sore. So that's, again, that's normal.
Okay.
Let's do 2 more. All right. So we can take this off. And I'll just take this off real quick for you. All right. So that concludes our treatment today, Sam. So, again, just kind of used a few manual techniques and everything, strengthening, stretching, just to hopefully decrease your pain and get you up and get you out of here. So, do you have any questions for today?
No.
All right. And then anything else you'd like to maybe potentially do or do again for next treatment?
Just the same stuff.
All right. Cool. All right. Sounds good. All right. Well, it was a pleasure. So we'll see you. We'll see you next time.
All right. Thanks.